One happening recently, not because of plant-based diets per se, but because a lot of people are going keto. And when you go keto, you go to the store now, go to Walmart, whatever, right? And there's all these keto products. The problem with these keto products is they're all grain-based, but they're not grain-based. They use gluten to do a low-carb bread. But I'm not talking about that. I'm talking about the nut flours, right? The almond flour, the pecan flour, these nut flours, right? They have a lot of oxalates. And even if you're on a plant-based keto diet and eat high oxalate foods like spinach or rhubarb, you will get this problem where you accumulate crystals in your joints. And for some people, it's in their skin and different parts of their tissues because it happens differently for all people for different reasons. But I'm also seeing people that get oxalates in their bones. And for some people, it could be a bone spur. But I pair this specifically with this calcium metabolism. So calcium is supposed to regulate, your joints, your bones, all that kind of stuff. But really, where people mess up is they get too much calcium, right? You get a blood test, you get a mineral test, and they say your calcium's low and you need more. It's not that it's low, it's just that the metabolism of how your body handles calcium is actually really bad. Some people take a ton of vitamin D. Everyone's first jumping into the array of health is, take vitamin D, take vitamin D. But the problem with taking a lot of vitamin D, right, is if you have a high level of vitamin D, you can actually calcify your body. And this is where the problems begin for those kind of people. You probably heard of bone spurs, right? Or osteonification, where, again, right, that cartilage, that ball and socket part, right? Some people actually have that turning into bone, and that's kind of crazy. So it's an accumulation of oxalates for some people. And for some people, it's just a terrible calcium metabolism. So what do I recommend for those kind of people? Well, first of all, going a low oxalate diet, of course, very important. You don't want more crap building in there. And also, for those people, right, with a bad calcium metabolism, stop taking a lot of vitamin D3. You're going to turn into more bone. Don't do that. If you're low on calcium, stop taking calcium pills. It's not helping you at all. So how do you fix this metabolism? Well, first of all, get more sunlight. You need sunlight to help you get the proper amount of vitamin D. If you get too much, you have lumisterol, tachysterol, and then it fixes the problem. But for most people, right, in this case scenario, you need vitamin K2. And most people are deficient in vitamin K2. And that is called activator X. That's the missing link that was found in the 30s, 40s, maybe in the 20s, that far back. And that's what's giving people proper bone, proper dental teeth, proper stance. People have bow-legginess, and, the other one works the other way, right? But in this case, you're probably lacking vitamin K2. And for many reasons, the gut bacteria is supposed to produce it, but leaky gut, leaky liver, bad habits, poor dietary choices, you probably lose the bacteria that produces that. But for those people, take vitamin K2, and over time, that should help you fix the problem by putting bone where it's supposed to be. And that's basically the simplest way to put it.